So now we're going to be looking at various manual muscle tests. I'd like to start off with the head and the neck. There's a lot of muscles, especially extensor muscles, in the back of the neck that attach to the head, and they're all so small and close together, it's very difficult to test each one of those individually. So we're going to be looking at the neck extensors as a group, which run all through the back of here. Alright, so basically you're going to start with the patient with the arms over the table so they don't recruit the power of their arms, lying prone, and bring your head back a little bit, up a little bit, okay. Now very gently with your palm at the back of their head, somewhere around due 17, and supporting their low back, you're going to have the patient push up and resist against your hand. Push up and resist, I'm going to press down, okay. And now we're going to test the extensors that are a little bit lower down, so bring your head up even further, and I'm going to press and you resist, and stop. Okay, you can relax your head. Alright, so anytime the patient is pressing against your resistance, you only want to resist it for 1 to 2 seconds. What we're looking for is the feeling of those muscles locking up. This is not a contest of wills, this is not a contest of strength. A lot of your patients will look at it like that, so they're going to really try and push up against your hand in different movements, but they don't need to do that. We're really just testing that first adaptation of those muscle fibers as they're working against an opposing force. So there only needs to be 1 to 2 seconds. So one more time, bring your head up. Alright, so we'll start at about level, and then I'll press down, you resist, and it locks up, so that's strong. See, 1 to 2 seconds. Now bring your head up a little further. Okay, now resist, and relax. So his muscles locked up, not in a bad way, it just they engaged. And that's what we're looking for when we test with the manual muscle test. Are these muscle fibers flexible enough and getting enough chi and blood that allow them to engage against that opposing force and hold their position? So now we're going to be looking at the more oblique muscles in the neck extensor group. And so what we'll do is we'll have Pete lift his head up a little bit and then look to your left. So we'll have him turn a little bit. And then I'm going to press here, right? And I'm going to press and you resist. Okay, and then bring it up a little higher, straight up. Okay, and then resist. Okay, and then let's do the other side. Right there is good. And resist. Excellent. Now bring it up just a little higher and resist. And that's good. Again, anytime we're working with the neck, you want to be very gentle. The line of drive is straight down, but again, it's a very gentle pressure. Now, Pete's, he works out a lot, he's very strong, but not all of your patients are going to have that neck strength. So again, you need to be very gentle when you're applying pressure. Anytime the patient starts to shake, you want to stop the test because the muscles are getting overtired. So that last test, with the torque in the head, that now is going to test the more oblique aspects of the neck extensors.